You are still tuned in the coronation night of Miss Universe Philippines 2022 live via virtual forum. We would like to acknowledge the presence of BSN24 Vice President Trisha Ann Ginto. Thank you so much for gracing us with your presence tonight. Are we ready for top 4? Are you guys ready for the top 4? And now the voting continues after we reveal the names of the top 4. Who among our top 10 will make it to the final stretch of the competition? BSN24, are you ready? We will be announcing our top 5 where the uniquely beautiful queens will arrive. Here are this year's top 4. The first spot belongs to Miss Tawi Tawi. The next to advance to the final round is Miss Benguet. This is your lucky night, Miss Basila. And for the last uniquely beautiful woman to clinch the final spot in the top 4 is Miss Sulu. BSN24, this is your top 4 and one of them is going to be the new Miss Universe Philippines. The final question and answer will happen right now. We have 4 envelopes here that contain different questions, and for this round, you will be given 50 seconds to answer, and if you go beyond that, you will hear this sound. This is your last chance to prove that you are deserving of the crown. So our judge will be asking questions to determine the top 3 in this batch. Please come forward, Miss Tawi Tawi.
Miss Tawi Tawi, please pick a number from 1 to 4.
Number 2, please.
Okay, so here is your question. How do you see our country's future healthcare 10 years from now?
Thank you for that wonderful question. So, how do I see the Philippines' future healthcare 10 years from now? Well, the first things that came to my mind were patients, technology, and money. Patients. I believe that the growing population of Filipinos will have an effect on our future healthcare because the higher the population, the greater the number of the patients. So basically, 10 years from now, I can see that there will be more patients who will be seeking healthcare. The next thing that came to my mind was technology. We are aware that today's technology has been improving for years and that it has been very helpful in different fields or professions. Healthcare industry will always come with technology. Nursing is about technology. So 10 years from now, I can see new equipment, new technologies that can improve our today's medical technology. So meaning, 10 years from now, there will be new and more advanced technology that can help save more patients. The last will be money. 10 years from now, I can see the costs increasing. I believe that advanced medical related technology will always equal to high cost. Thank you.
Thank you so much, Miss Tawi Tawi. Next up, we have Miss Sulu.
Miss Sulu, please pick a number.
Number 3, please.
So here's your question. What are the pressing issue or issues in our society that has a great impact on our healthcare system?
Thank you for that question. One of the societal issues that have a great impact in our healthcare system is corruption. It destroys the organizational focus and quality of services in the country, as well as promotes unequal budget allocation for different sectors, causing a financial shortage in our healthcare system. This results in poor compensation for our essential but undervalued healthcare workers, leading to shortage of healthcare workers in our country. Poor budget allocation can also lead to poor healthcare delivery and inaccessible systems. I also want to add that the recent global pandemic also overwhelms the healthcare system. It restricts the capacity to provide quality healthcare services to the community. And with that restricted contacts, it is more of a challenge for them to address the health concerns. And that is all. Thank you.
Thank you so much for that answer, Miss Lou. Miss Basilan, please come forward.
Pick a number, Miss Basilan.
Number 14.
So this is your question. What issues or needs in the healthcare system will the universal healthcare law address?
Thank you for your question. There are lots of far-end and low-lying communities all over our country which do not receive basic healthcare and basic health education. And this is the main issue that the Universal Healthcare Law desires to address. The Universal Healthcare Law, or the UHC law, is a mandate to ensure that every Filipino in all sectors will receive quality healthcare, have access to the healthcare system and services, and is deemed affordable, especially for the low-lying communities. Healthcare has become a privilege when it was supposed to be a part of our basic needs. The reason why, no matter how large the health promotions are of health services, individuals and families who are financially unfortunate just ought to shrug them off. To add, ensuring that this law will be carried out smoothly, it promises to provide enough human resources, facilities, and financing. The involvement of the promise for the adequate human resources of this mandate shall be followed through, as the prime movers of the healthcare law are its health team members that can thoroughly provide services within health facilities and within the communities reaching far-flung areas of our country. Thank you.
Thank you so much, Miss Basilan. Lastly, Miss Benguet.
The last envelope contains your question, so listen carefully, Miss Benguet. This is your question. What is or are the immediate healthcare needs of our community, our country, and the world as a whole?
Thank you so much for your very wonderful question, Ms. Quinto. I think the immediate healthcare needs of every person living in our community, in our country, and in the whole world are, first, the health education, because not everyone is educated enough about this matter, and it is very important for the people to know and understand different conditions that affects their health, disease preventions to stop the outbreaks, and to be able to have a disease-free environment and learn what and how diseases can be treated. Second is the access to medicine, because many places, not just in our country, but in all parts of the world, suffer from the lack of medicine due to limited resources, or worse, they do not even have any access to it because of its high cost. Third is the use of emergency vehicles, which are very important in times of emergencies or in situations where a patient needs to be transferred to another health facility to have access to the care they need. Lastly, it is not just the problem about unity of every healthcare personnel to deliver care, but also on how efficient the regulatory systems are and how transparent the government is towards universal healthcare. Not everyone has the access to the healthcare that they need due to financial hardships. But if the government will focus more and pay attention to the issue of health, everyone will have free access to health to have better health outcomes, better healthcare financing, better service delivery, and better regulation in health. And I thank you.
Thank you so much, Miss Benguet. There you have it for our top 4. We will have a short break before we announce the top 2 of this year's Miss Universe Philippines.
magandang balita, hindi na mangangamba ang mga mamayang Pilipino dahil naririto na ang nagpapatibay ng local healthcare system ng Pilipinas. Ito ang Interlocal Health Zone o ILHZ. Dito sa Interlocal Health Zone, nagtutulungan ang mga hospital at mga komunidad para maibigay ang pangangailangang kalusugan.
Gumagamit sila dito ng maayos na sistema para paghati-hatian ang mga kagamitang pangmedikal, medisina, tauhan, pasilidad at pondo para sa bawat health center. Isa sa mga lugar na gumagamit ng sistemang ito ay ang Benguet para masolusyonan ang kanilang problemang pangmedikal.
Isa rin sa mga sistema ng ILHC ay ang Common Health Trust Fund. Ang bawat komunidad, kasama na rin ang local government unit, ay nagbibigay ng budget para mapaayos at mapabuti ang health services na naibibigay. Ang perang binigay ay tinatawag nating trust funds. Dito malalaman kung saan at paano ginastos ang mga pera. Pero tandaan, bago ito maisagawa, ito ay dapat sabay-sabay sang-ayunan ng bawat komunidad. Sa pamamagitan ng interlocal health zones, masisigurado natin na mapapabuti ang health capacity development, ang health insurance certification, at medical supply system ng isang lugar. At muli, dito sa ILHC, siguradong may kalusugan at may kalinga ang lahat.
Para sa Healthy Pilipinas!
With 81 contestants and now down to 4, and at any moment, only 2 finalists will be left standing. Okay, so get ready because here are your final 2. The first finalist with a chance to take the Miss Universe Philippines crown is Miss Basilan. Our final contestant in the top 2 is Miss Tawi Tawi. You have to stay right here where you are because the next round begins right now. Now each contestant will be asked the exact same question. You've each got 30 seconds to respond. If you go over time, you will hear this sound. It's time for your final word, Miss Tawi Tawi. Please join me.
How are you feeling, Miss Tawi Tawi?
I'm good, but I'm kind of nervous.
Okay, so here is the question. If you will be given a chance to be in a position where you can implement change and pose solution to our healthcare issues or needs, what would it be and why?
Okay. Thank you for that question, Judge Ginto. So, the government has a big factor on how the healthcare system of a community will be. If the healthcare system is bad and full of issues, I believe it is because of the government. So if I will be given a chance to have a position and will have that chance to implement changes, the first thing that I will do is to increase the budget for the Department of Health. After increasing the budget for the TOH, I will now be able to build more infrastructure, especially to those places that the hospital or center are not easily accessible. Next step is buying high technology equipment because I want the Filipino to forget the mentality of I will go abroad and be healthy there. I mean, what's the reason of going abroad if we also have those technology as theirs? Next will be increasing the salary of the healthcare worker in the Philippines. What is the essence of having a competitive Filipino healthcare workers if they are migrating abroad just because the salary in the Philippines is just half of the salary that they can earn abroad. It is important that we value them and give them importance because they are the key to a successful healthcare system. Thank you.
Thank you for the very wonderful question, for the very wonderful answer, Miss Tawi Tawi. Miss Basilan, please come forward.
Are you ready, Miss Basilan?
Ready as I will always be.
Oh, so here's the question. If you will be given a chance to be in a position where you can implement change and pose solutions to our healthcare issues or needs, what would it be and why?
Thank you for your wonderful question. It is very hard to implement changes, especially when our healthcare system has been ranked through history by the corruption that runs in politics. Although, what I, and we rather, can first impose to ask is the full financial support from the government for our healthcare workers. The increase in the salaries for our dearest healthcare workers has been promised year through year, and not a single peso was increased. When this can be finally imposed, then secondly, we can propose a depletion of the numbers of healthcare workers that are exported to other countries. If there are enough healthcare workers in the country, it is more than easier to extend delivery of healthcare services to each and every individual and family in the provision of the universal healthcare law. The increase in the healthcare workers will decrease the number of people who lack knowledge of the health services that they are rightfully entitled to. That is all. Thank you very much.
Thank you so much, Miss Basilan. Ladies, after months of sacrifices, training, and hard work, we have finally reached this point. A new queen will be crowned, and may the uniquely beautiful woman win.
And our Miss Universe Philippines 2022 is